Hi, my name is Emily Balmer and I have the Hearing Suite here in Harrogate, North Yorkshire. So this channel, the Hearing Suite channel, is all about educating and informing you about hearing, hearing loss, tinnitus and ear health. If you find these subjects interesting, then feel free to subscribe below, and if you hit the notification button, we will keep you posted on all our latest videos. Today I wanted to talk to you a little bit about sudden hearing loss. Now, sudden hearing loss is unusual, it's rare, and I'm not talking about the kind of hearing loss where no wax has been building up in your ear and it starts to feel a bit more blocked, or maybe you've put your head under water and water has gone into your ear and you're not hearing as well. I'm talking about a significant change in your hearing which happens overnight or almost immediately. We need to talk about these kinds of hearing loss because they are a medical emergency. Now, they tend to be viral. There are a few different reasons for them, but under some circumstances, if we can treat them quickly enough with steroids, the hearing can be restored. So it's really, really important that we take them seriously. Now, I'm filming this in April of 2020, and we are currently, in the UK at least, under a lockdown with the coronavirus. And I would be saying to anybody that experienced a sudden hearing loss to still take it seriously, to talk to their GP, and make sure that they're confident with the advice that they're being given. Because it might not be possible for you to get the usual steroids at this time. It might not be safe for your body to be exposed to steroids and your immune system affected in that way, but it's really important that you're still able to make an informed choice. And you can do that in a number of ways. You can do that by talking to your own GP, talking to them about their experiences of sudden hearing loss in the past, and making sure you're happy with a care plan. You could speak to your audiologist. There are certain ways, even with the restrictions in place, that hearing tests can be conducted under an emergency, especially if we have the sign-off from an ear, nose and throat consultant. There are also audiological practices that have contact with an ear, nose and throat consultant who can give you that very best advice to make sure that they're protecting you during this pandemic, but giving you the best opportunities and the best options with your hearing as well. Under normal circumstances, in the world before March of 2020, February of 2020, if you had a sudden hearing loss and there was no visible blockage in the ear, it's important that you have a hearing test. We need to know if the hearing loss is sensorineural, and it's important that you go to A&E because, as I say, it is a medical emergency. Again, I would recommend that you get in touch with an audiologist in the first place. I know very few audiologists that wouldn't do an immediate hearing test for you, because for us it's a big red flag. So it's really helpful to be able to take an audiogram hearing test to A&E with you, again just so you can have that best advice. And again, if your audiologist has those contacts with an ENT consultant, then just making sure that they're ready to receive you at the hospital, so that steroid treatment is guaranteed. So that's just a little bit about sudden hearing loss. As I say, it's very rare, but I think it's important that we're educated and that we know to treat it as a medical emergency, just as we are with other conditions at the moment where we're having to navigate things a bit differently in this kind of coronavirus period. But if you have questions or concerns, I would really, really strongly advise that you speak to a healthcare professional.